Right. I think we could probably get started. I just wanted to thank everyone for being here again today. And thank you so much to Dr. Saba for yesterday's training. It was excellent, and we learned so much from you and got great feedback already from people who attended. So, yeah, thank you so much. And I'll hand things off to you again.
All righty, great. So I'll good to see everybody again. And sorry that we didn't have, we not able to do like the full check-in names and everything from everyone. So I'm not totally sure if we have, complete overlap with yesterday or if there are new folks, but in either case, I'm glad that you're all here. Let me just put this on the correct slide first. And all right, so we are officially on day two of our uh, conversation and discussion about artificial intelligence for people in our profession, so for behavioral health clinicians. Um, and again, we're wanting to, provide a pretty balanced approach here, where we're, excited about capabilities, but also, sober and aware of risks and how to do this responsibly. So. Um, so yesterday, just to recap again, I recognize some folks for sure, who had screens on and pictures on their Zoom IDs, right? But just in case, yesterday we talked pretty broadly about the space and did a bit of a lay of the land with respect to the kinds of technology and clinical applications that are coming available, but then really spent some focused time on AI scribes, given the relevance both for, clinical utility and also like administrative rights, EHR systems. Um, I think, and from people's participation, it seems like this is going to be one of the more rapidly growing spaces for our field. Also, have to talk about the mainstream LLMs because, they're things that many of us are interacting with on a day-to-day basis. And so knowing, whether and how not to, work with those things in our work. Um, and the one of the kind of main messages, hopefully, from yesterday is that there's reason to be excited, right? There's a lot of potential to enhance care and also improve efficiency. I know is a big need for many of us. We've got to be sort of wide-eyed and bring our knowledge and our judgments. And so with that being said, that's really the focus of today. And in a lot of ways, today is I don't want to say harder, but more complicated session in the sense that, yesterday, I'm glad that people raised, their cautious optimism and their skepticism. But for the most part, I got to kind of be like, look how cool these things and potentially, helpful these things are, right? Whereas today, we really want to spend some time in the nuance of, how to use responsibly and what to think about ethically and what to think about in terms of if things work for us or not. Um, and finally, how to keep learning, right? So we're not only going to talk about things like, ethics, privacy, safety, effectiveness, but we, to somebody's point yesterday, this is such a rapidly growing space that like knowing what to use today or what we might want to use today might differ from what we might want to use tomorrow. We can spend a ton of time learning about different options. And so I want to give us the toolkit to, move forward and continue to learn and continue to have resources and continue to think about this. Um, One kind of finer or specific point here is also going to be how to respond to clients' use of AI. Given that this is going to be one of again the biggest areas of AI in mental or behavioral health is just the people that we work with and the general public, going to ChatGPT at 1 a.m. at night and sharing about what's been going on and trying to seek some support and feedback, right? So how do we think about and work with that? um, I think is a key question in our field. So we started our check-in yesterday, or we started our session yesterday with a bit of a more general lay of the land in terms of, or a general kind of, temperature taking in terms of like how people are kind of, feeling or the gut feelings about this. And so now I want to get a little bit more specific or hear a little bit more specifically from people. Given that we again we did the scope of the possibilities yesterday, right? And I know that you're seeing this in your practice, in other people's practice, in your clients' lives, on LinkedIn, right? So what are things that you're seeing that either excite you or that give you pause? And one thing I mentioned LinkedIn, one thing that comes to mind is the like, the how many people are just kind of posting regurgitated LLM content and kind of, acting like it's theirs and hopefully maybe not source checking very well. I worry about the discourse in terms of being accurate and thoughtful and and an online space for what it is or what it isn't, and that affects what people have access to in terms of information, right? But that's just one thing. I could name several others, but if you want to put into the chat, we could do a quick kind of chat storm. Maybe I should have said that before I launch into my tirade. But yeah, what's exciting? What's giving you pause? What's concerning specifically? Some things people are seeing. I'll give a couple, moments here. This will help frame the kind of conversation today about knowing what to look for and see and uh, how to validate and all of that stuff. Oh, I see. Caitlin, thank you. AI that takes what is discussed in session, translates into notes, um, takes whatever is discussed and implements into paperwork. And you didn't indicate, but I'm guessing that this some for me personally, this is something that's both exciting and gives me pause, right? As we kind of talked about yesterday, there's reason to be kind of stoked, right? That like, oh, this could be helpful for me, but also like I want to make sure I'm using it in a way that's above board and that kind of works well. Anybody else? What are people noticing things with client use of AI even? If people want to jump in verbally, that's fine too. So Sally, I know of several people on the autism spectrum who take it too literally, as they do with human interaction. Gemini is becoming their friend, and that's a really, great point. The folks with autism and beyond, right? Like, there's something that's uh, both similar to, but also different from, person to person conversation, right? And so, um, when we're missing verbal cues, or we're the nonverbal cues, sorry, right? Like you're not sitting with a person, and which may make it harder for people that have to kind of be very attentive to those things base level to notice them. Similarly, right, like I think there's uh, concern and need for further research we'll talk about today with respect to youth and companion chatbots and even the ChatGPTs and the Claudes and the Geminis, right? Like somebody kind of feeling like they're developing a parasocial relationship with those, and how does that map to development for young people is a question. So I'll kind of go ahead and move forward here, and if people have other ideas, you can obviously feel free to throw them in. Um, but so it's important, to, as mentioned earlier, to kind of know what to assess. I mean, you all are used to thinking this way already, right? If you work with somebody, you're assessing, a lot of things about them, a lot of things about their broader, the broader system that they're living in. Um, their area of work and recreation. when you adopt an intervention or you consider adopting an intervention, you probably get some training, right, in the intervention. You probably think and maybe do some reading about like, does this fit into the context of my practice and into the context of my agency and into the context of my the life of the folks that I might be, working with this intervention. And so what we're kind of like the field, many of us are positing here is that we need to treat technology and AI use specifically similarly. And I think I made this point yesterday, but it's interesting to me that I think we maybe didn't spend enough time thinking about this with respect to technology in our spaces generally. And so we sort of have this forcing function with AI where we have to, maybe the stakes are higher in some respects. And so it's causing us to kind of step back and say like, okay, how do I know if we want to deploy this where I work or if I want to use this personally in my practice, right? And so what I'm going to kind of share here on this screen is largely kind of adapted from this READY framework um, by Stade et al. And they're a group out of Stanford. I actually work with, or I'm writing a grant with one of the senior authors to do some implementation, work in a VA setting on some tech tools. So she's really great. Her name's Shannon Whitley Sturman. She's one of the authors on this. But anyways, so the domains are several, and I've tried to bold the domains here. I made them kind of map word for word to the domains from this framework. But safety, right? Safety is, at the very least, we want to not be harmful, right? And we want to avoid, harm um, wherever possible and be clear-eyed, right? And so are there clear crisis protocols? How do these tools or things that we're deploying, if we're deploying a tool that says it's flagging risk, is it flagging risk well enough, right? Is it missing risk? And is a human in the loop? So we talked yesterday about the chatbots that have been, studied in the research literature and how even in those research studies, like there needed to be people kind of tracking the interactions and then sending messages out, right? And so to the extent that that remains the case, is that correctly being handled? Um, are people's privacy and confidentiality, right? Like the vulnerable folks we work with protected. And so we're going to talk a little bit more about that on the next slides because I think rightly so, a lot of the questions that you had sent previously were about privacy and confidentiality. So I want to spend some focused time there. Um, and then, equity across groups. And there's a lot of places where inequity can show up, depending on the technology and the tool, everywhere from the data that trains the AI, right? It can be grounded in Western or majority or certain kinds of populations and less so certain other kinds of populations, right? Probably not a lot of AI training is happening in prison systems, right? For example, or in inpatient psychiatric settings, for example, right? Um, and then similarly, like, that we want to make sure that, people are, I guess this will come a little bit later, but as people are involved in development or not, you could probably make the argument and find cases where they've become less sort of relevant culturally or developmentally, or in terms of things like reading level, right, for certain folks. So that's kind of an important question with respect to equity. Um, Effectiveness. So again, effectiveness is something that you probably already think about when you think about whether you want to use a certain evidence-based intervention already, right? And so similar questions apply here. Is there peer-reviewed evidence for the products for the tool that you're thinking about using? Is that evidence, does it apply in the specific use cases that you're thinking about? Or, did they share one study on, folks with moderate depression and you're not sure if it's going to work with folks with substance use disorder, for example, right? In this space, we want to be really, really cognizant of the fact that, we're now kind of in the tech industry, right? And so like people are going to be trying to make money and sharing a lot of marketing claims. And we have to know how to kind of sift through that. Um, the in a lot of cases, the truth of the matter right now is that most things don't have, several RCTs worth of evidence. So does that mean we just don't use them? You may have that as a hard line for yourself, or you may say, well, I at least want to know that this is based on an evidence-based intervention, and maybe that people from our profession were involved with adapting the intervention for this platform. I can feel good enough about that, maybe, right? Um, this third bullet is kind of about like, how does it work on a technical level, right? And so if you remember yesterday, we had the multiple kinds of AI, and we had predictive AI, and we had generative AI, and we had agentic, and we had, at the end it was like there's these more sort of simpler but more reliable rules based, right? And so as you become more complex, it's like these tools in some ways become more compelling and interesting for some uses, but then you want to balance that with like what's the risk of if they go off the rails and do something totally unexpected, right? It may be in some cases we want something to always reliably give us the same exact answer, and so that's where we would say a more traditional machine learning or a rules-based system might be better, right? Versus an LLM or an agentic system or something like that. Um, Again, when we, with a lot of machine learning, again, it's about like identifying somebody at risk for, let's say, depression in the future, suicidality in the future. And you might remember yesterday we had like a slide about, oh, this thing had 93% accuracy. Well, if it's if 99% of the people don't ever have the bad outcome, and the thing always guesses the person's not going to have the bad outcome, then they can just get a 99% accuracy, but get every single person who has the bad outcome wrong. And so you always want to say, well, does it also identify the people that have the bad outcome? You basically want sort of multiple performance scores here, both for yeses and for nos. Um, Again, going back to this question of like who was involved in development, um, the extension being like, is this something you would actually want to use? This is something people from, that you work with would actually want to use. Sometimes there's published or marketing material, or, you could maybe, we'll talk a little bit later about like, maybe you can consult with people, from populations that you work with and say, hey, like, we're thinking about deploying this thing. Is this actually interesting to you, right? Like, or would you maybe use it a couple times and stop using it? Because that's pretty typical in like the digital health space, actually, right? So finally, um, a lot of us in the research space tend to stop here. But really, really important is this actually going to work where I work, and where I'm thinking about deploying this? What are the costs? What are the training needs? Is there somebody on site that can, that could manage this thing? Would we need to hire somebody else? Right. And again, how much would that cost? Do we actually have the capacity for it? So all of these things you can dive more deeply into in this framework paper. Um, there's also, for a bit of a quicker kind of a checklist, I've included this link to an APA checklist. And it was like late 2024. I think it was published, and it's like a, AI tool, like, kind of fill out information about privacy and about like how are there clinicians on the team, right? As a way to kind of quickly get at a lot of this stuff. Um, because it's late 2024, and this stuff is moving so rapidly, maybe there are some things that are, maybe you supplement with questions from this framework, or think about whether additional questions might be important for your uh, uses or your settings. So we're gonna, I guess I know that I talked a lot here, and this is a lot of singularly important stuff like bullet by bullet. And so I want to just kind of pause for reflections or questions. Okay. So, um, as I mentioned, um, a bunch of we I think we got a handful of questions, and I'll put some of them on up on actually on the next slide to try to answer directly. If there are a couple more that are kind of integrated into the slides here, um, but before I do that, before I think it's important to kind of set this big picture framework on, how do you think about privacy generally? People ask, hey, like how do I know if, do I just kind of take it at face value or like are data protected, et cetera, right? And the bottom line is actually that like I can't answer that question in a blanket statement because there's so many different tools. Again, as folk kind of identified yesterday, there's so many different kinds of tools, and within each tool, there's different kinds of data, right? And so, if you're talking about again, something like let's just for the example's sake, say like an AI scribe tool that was developed for deployment in clinic. The company is trying very hard to be, above board, HIPAA compliant. They're trying to be legit. Then you're probably in this bullet here where it's a healthcare grade tool. And if you work with them as a vendor, you can, you should obtain something called a business associate agreement. Um, because then they're kind of contractually bound to the agreement and what they say and don't say. And so then you want to know like what is said and not said, right? Um, we'll come back to that in a second. Whereas, for the kind of the general purpose tools, or maybe there's, things available in sort of the research realm, you can download it on your computer. It's not necessarily a company that's trying to grow or anything, right? Like, um, they might not have a business associate agreement. They might be training on client data. They might be like a little bit unable to tell you, what's gonna. So we'll have the Sam Altman quote actually up in a bit, but we'll just for now we'll say, it sometimes it's you're not able to be totally clear with these general purpose tools, right? Like what's going to happen with the data. Um, they're usually not covered by HIPAA. Now, the caveat being, again, this is so rapidly changing and growing, someone like OpenAI, for example, and maybe Claude now and probably Google, right? Like probably Google has some business facing platforms at this point. They're offering things that would are starting to maybe fall under this BAA, right? Now, ChatGPT Health, which is a consumer facing product that like your client could say, okay, I'm going to connect my watch or my Apple Health to it. That's not a business facing product, right? It's just them and ChatGPT. And maybe there's some increased privacy, maybe not. I'm not totally sure, actually, right? And it's probably kind of hard to get your head around. Requires a close reading of the policy. But this ChatGPT for healthcare, if your institution uses something like this, then you can probably have written down some of the privacy and safety and all that stuff, and it can be a little bit clearer. Now, for clinicians, I think that's missing the four there is it's I think something a little bit kind of in between where you're putting your NPI, but they're not like creating a business agreement with you, right? And so again, just important. I think the take home here is that you're going to see a lot of different solutions that sound more or less maybe legit, and you still want to become very clear, about whether a BAA exists, whether, and what it says or what it doesn't say, right? Or what the policy says or doesn't say. Um, Now, the other kind of complicating piece of this is that it's not just that there are a ton of different, platforms and tools, but within the platforms, within the tools, um, there are different kinds of data, and the different kinds of data, you know, I say likely here, and I think clearer way to say it is like in many cases they do have different clocks actually, right? And so the scribe, for example, might record audio, might first record audio to transcribe it, and even if they delete the audio or they don't save the audio, they don't retain the audio, well, what happens to the transcript? And you're probably keeping the generated note, right? And so what happens is can they train on the generated note even if they're saying they're not training on the audio recording, right? Or are there loopholes? There may be loopholes for them there, right? Um, Metadata and logs. So like, just at an aggregate level, like, recording how much you're using it or maybe even like aggregate information about kinds of clients or something like that, right? I'm not totally sure what the range of metadata looks like, but we live in a data e world now, right? Now, again, even if there's a BAA, um, these are businesses and I don't want to say trust nobody, but at the same time, like we have to be aware and protect ourselves and protect our clients and sort of know uh, what's possible and what to look for here. So again, a key thing being that even if sessions aren't recorded, um, transcripts might be retained, right? The typed out transcripts, right? And so what happens to those and what about the kind of the metadata, et cetera. So bottom line here, um, is it safe or is it private? Is the question, right? So and it depends and it varies based on what you're using. And even if you're using one thing, that one like different kinds of data and that one thing might the policies might vary for the different kinds of data. So being able to obtain, read the agreement policy, um, and I'll have some questions for you on the next slide to, that you can have ready to kind of ask vendors. And actually one, if you maybe they put out a policy document, right? And you could there tend to be hundreds of, a lot of pages, right? You put the policy document in an LLM and ask the questions in the LLM, right? Like here are the questions I want to know if this policy document answers, right? And tell me where, like uh cite the sentence or give me the full paragraph so that I know that you're not taking it out of context, right? Those are good kind of follow-up questions for an LLM. So these were some of the questions that you uh, had sent around before we got together, and you'll notice again that they're pretty privacy focused and they're again they kind of are answered by the it depends statement. And so how long is client information stored? Again, it depends on the specific tool and the data type. Um, and again, see the business associate agreement or get one and see it if that's applicable. Again, this point about, different kinds of things being stored for different amounts of time. Um, how do we know if things are really deleted? Do we just trust the vendors? Um, and like again, the kind of the reputability of the company probably matters to some extent, but also like again, they may be able to write things in a way that gives them a loophole, right? And so, and again, we'll come to the case of the mainstream LLMs in a little bit, but like data deletion is murky or like, like there are privacy settings, but then like if you turn the privacy on, oh, well, we still retain it for 30 days, right? Or, but we promise we won't train on it, right? Well, do you train on what if you create something based on the retained data? Do you train on that retained data? Newly created thing? I'm not, it's not, it's difficult to know these things. And so this is why I think, we're going to have kind of the hard line. And even the CEOs will tell you like the hard line around like, don't share things that you wouldn't want to go to, some kind of authorities or that, for in our case, obviously don't share client sensitive and private information, right? That's kind of the take home message here. Um, again, um, uh, for clinical tools with BAAs, I think the do we just trust them is a good question because we want to like I- I've seen, written in vagueness and loopholes. And so even if they're kind of meeting their own written down thing, well, maybe they've given themselves kind of a way out that we want to make sure that we're aware of. Um, if we leave it out of our node or even delete our node, right? Is it gone from the AI? Well, it depends on the agreement, right? Like, does it say in the agreement, like if you delete the note or if you opt out of, I don't know, like having the scribe, make the note on your end, does that also mean it's not going to make some kind of note on the back end? Like that's something that you want to be kind of aware of. Um, again, we in our field want to be really, really clear about subpoenas and the possibility of being subpoenaed. And so this wouldn't necessarily mean like we're subpoenaed, but maybe a scribe company is subpoenaed, right? And so that's something that we may want our clients to be aware of, right? Like, hey, I'm using this tool. Here's what I know about what's retained. Here's what I know is not retained. Just so you know, like, it's collecting metadata on like the average age of the people that I'm treating, right? And like some that could get out or whatever it is that could get out, right? So I think, like you asked really good questions and really important questions. And on some level, the take home message is you should keep asking these questions to the vendors, and whether that's verbally or asking by consulting policy, right? These are the kinds of questions you should keep in your mind and in your conversations that you're having. So a few kind of like tips to that end in terms of what to look for in written policy and what to ask these vendors, right? Is there a business associate agreement, right? Um, like what have you kind of legally obligated yourself to in working with us as an agency or not? Um, and or at least like what's in your written policy, right? Like what's in what you put out there about your own product. Um, and so what specific data okay, you're telling me that you don't record audio, but what do you keep, right? Like are there things that you're leaving out of that sentence? Okay, how long do you keep what you're saying that you're collecting, right? Um, again, the training thing, it's like maybe you don't train on this, but do you train on that, right? And okay, can we opt out of, making our data available for training? It just introduces another to this point here, like if they're training on data, like do they know where your data is going, right? Because maybe they work with some other, some technical team or external AI team to kind of train their product, right? And so then what happened? Like what's the kind of sequence of events there? And then more generally, are you sharing with third parties? Does that apply to every kind of data that you're collecting or not, right? Um, can we these like can people opt out both in terms of like training, deleting, not participating, right? Like I'd like to use your product. I think somebody made the point yesterday. um well, I'd like to do the transcription, or I'm planning to do the transcription but not necessarily the intervention, or the conceptualization piece of it. Okay, if we don't do this on our end, are you still learning these kinds of things or thinking that you're learning these kinds of things about um, our clients, right? What happens in the event of a breach? How confident and safe? What are the kinds of procedures are there against potential breaches, right? Um, I'll pause again because these are very what's it called? Dense slides. It's going to be kind of a theme today because okay, great. And feel free, as I'm going along, if questions come up, feel free to do a hand raise or even just jump in if there's a moment, or put messages in the chat. So In terms of legality, one of the important things to think about or know about as a clinician is how the legal landscape with respect to what's acceptable, allowable, soon to be not acceptable, not allowable when it comes to AI for mental health. Um, this is moving quickly, and it varies by state, and it seems like it's gonna continue varying by state. Um, where, for example, Illinois and Nevada, um, I think if I remember the reading correctly, it's like they're banning AI from like pretending that it's a clinician or providing, actual treatment, right? Providing care, like kind of billable treatment, right? Um, that kind of leaves loopholes for things like, support, right? Like, you maybe like stress management, however you want to label it, but you can't provide psychotherapy, right? Or act or pretend that it's a clinician. Um, in New York State, because I think all or most of us are living in New York State. I wanted to make sure that we touch on New York State. Um, Current uh like a recently passed state law is that companion AI companion chatbots have to disclose that they're AI. So even like, if you're using ChatGPT or Claude or something, and at the bottom it says like this is an AI system, right? They all have to do that in New York State, whether they're therapy chatbots, whether it's character AI, right? The kind of the use-facing companion ones, whether it's general purpose ChatGPT, right? They have to say that they're AI, clearly, and they have to build in protocols to detect and respond to suicidal ideation and self-harm. Now, we're in a kind of a space where, we're not uh, very confident that these protocols are effective enough, but still, like they have to have them built out, to at least some degree. And we'll come back to this point in a minute. And so pending in our state senate, which I think they're still trying to get it passed. Um, this S8484 would restrict it. It's similar to the Illinois and Nevada uh, laws, actually, where it would ban like therapy, right? Like actual treatment, actual psychotherapy um, by AI, supplementary support. So even like using a scribe tool, um, especially where things are recorded, transcribed, requires informed consent. So I think somebody asked, one of the questions people asked is like, is informed consent becoming a requirement? And, at least now in the case of scribe tools or, where things are recorded, transcribed in New York State, seems like it may be going in that direction. Now, there are other kinds of AI, right? Like, so that doesn't necessarily apply to like an EHR system that just flags risk based on demographics or symptom change. If people are doing like a PHQ every week, and like, oh, your PHQ seems to be going up along with interaction with all these other data points, right? That kind of thing currently doesn't require informed consent. Now we're going to kind of come to this in a bit. You could make the argument, well, I'd still like to um, have people provide informed consent or something like that. Um, this bill or law, wouldn't require religious counseling, peer support, and self-help kinds of work or agencies to do the same kind of informed consent or have the same kind of restriction. Just FYI. Now, um, we want to stay informed and compliant, right, with the law. It's changing very rapidly. Um, I've linked. So again, all of these blue underline things in this slide deck, which I'll share, are clickable links. And actually, there's going to be a resources slide at the very end that should include most, if not all, of the blue underline link things, as well as some other things. But we have this US AI law tracker, which is a very big picture. It covers a lot of different kinds of AI and really, I think, all law relevant to AI, so beyond just healthcare. But if you filter by state, right, you look at the New York State ones, the list becomes kind of manageable enough to just keep kind of track it about what's coming up in New York State. Um, so I think that's pretty good. Also, this says NASW, but it could also say APA, ACA, right? So whatever your professional association and the state chapter of your organization, that can be another and probably should be another source of staying up on important kind of guidelines and laws and things like that, right? That are relevant to your profession. Finally, I'm not a lawyer. So, this is all just me sharing information that I, found on the internet and I've seen other people talk about. And so, in terms of like how these things apply to your specific context, service setting, if there are changes, if there's nuance, you want to make sure that, that you're running things by a legal professional, right? So yesterday, somebody asked about, this is a really, really good question. So we're kind of in like the macro space now, right? We talked about the law. Um, well, what about, the impact of AI on climate, on broader communities, and not just AI, but like data centers, which are hosting AI, but also hosting, many things more generally, right? So, um, well, I'll just kind of present this information and my kind of take homes from it on the next slide. But like in terms of a single text prompt, right? Like if I, ask, ChatGPT, Claude, or probably even like click the scribe, uh, you know, like conceptualization button, right? Or something like that, right? Like a generative AI use. Very little energy for one prompt, right? So according to Google, which take with a grain of salt, right? But I think other people have done kind of similar work here. A typical Gemini text prompt, and this was as of 2025, was about the same as 9 seconds of TV, right? So kind of like along the lines of how we're typically using sort of electricity for a normal text prompt. Um, However, bigger tasks like, if you turn on, max reasoning, if you do image generation, if you do video generation, substantially more than the single text prompt, right? It's still, I could have had, I think, more specific information here, but it's still not like it's going to be more than like your travel, right? Like, or if you take an airline flight or something like that, right? But as you do more intensive AI work on your own, your footprint with the AI goes up. Now the real concern, um, or in terms of like the real impact, is the scale of it, right? It's not necessarily me with my single prompt, it's the training, it's the number of millions of people doing the millions of prompts, right? um, and training AI is a whole nother thing, right? um, so US data centers that kind of handle all of this stuff used about 4.4%, so that's this here, of US electricity 2023. Projection is that it's going to by 2028 be somewhere between here and here, so growing, right? um, Now, important to note, like data centers are doing more than just AI, right? And I've seen some figures where it's actually a pretty small piece of it, but I suspect a growing piece of it, especially again with the amount of training that's happening and the arms race of these large AI companies, right? Now, again, electricity is not the only thing we have to be worried about. Data centers also use, relatively large amounts of water for cooling, and um, unfortunately, they can be built in places that are short on water. So that's a, ethical kind of conundrum there. Um, the other piece of it is that, beyond just electricity use and water use, they often will turn on these gas turbines to essentially they're like on-site generators if like, they need more than just the grid power can kind of give them. And so those on-site gas turbines are very pollutive to the local air. Now, as has been the case with a lot of like sort of industrial advance and growth of industry and stuff like historically, right? Like it's often the case that these kinds of uh, industries and infrastructure are deployed in places that are especially vulnerable and like that don't have the kind of the power to say no or to say like do this somewhere else, right? And so um, these on-site gas turbines, this water usage, these burdens are often falling on low-income minority communities. So this is a climate, public health, and environmental justice issue. So even if it's not the case that like, oh my single prompt to Claude or ChatGPT is going to tip the scale here. Well, if I want to be a concerned citizen, like I have to be mindful of just how this whole interconnected system is working. And so this is, I want to just be kind of humble here and say like, this is a bigger question than I have the answer to, right? But these are some thoughts, kind of just based on the information and the trends. And we should also say that right that like that even the electricity use is probably growing, right? And but then there's efficiency gains, and it's kind of this back and forth. Um, so on the one hand, your individual leverage over the footprint of AI is relatively minuscule, right? Um, Still, given again this interconnected system of technology and industry and energy, right? Like we want to be mindful as people, as help people in helping profession, and I think as a society of like our tech usage and consumption as a whole, not just AI, but we want to find ways to kind of offset, again, not just our personal, but our sort of larger social carbon footprint. Um, so as an individual, one kind of thing that, is kind of just good clinical practice actually generally too is like, you know, think about kind of efficient and like what's a need to use versus like where am I just kind of spinning my wheel, especially with something that's requiring a lot of tokens and the agentic stuff, the reasoning, the multimodal, right? Like do I need to create a video for a client knowing that like I'm probably going to watch the video and be like, actually, this isn't very useful, right? Like maybe in some cases the videos are useful, right? But maybe they're not. Um, Again, the things that are most going to be most impactful are system level changes, right? And so, how electricity is generated, where, where data centers are built, how they're cooled, um, you know, do communities have local say, right? And so can we be um, advocates where we want to be and where we need to be? And I think it's a little bit beyond the scope of the talk, but like we probably should be moving towards more renewable forms of energy, right? And so like how can I be a part of that change, right? Can I be a part of that change, right? Um, and to that end, society likely needs more advocates for, uh, you know, it, uh, renewable energy, environmental justice, sustainability, et cetera, right? Um, so again, I will, this is me humbly kind of sharing my reflections based on hearing about this and then also trying to do some kind of thinking about it in the past, 24 hours. But so I'm curious if other people, including maybe the person that raised the question, have thoughts or reactions.
Hi, it's Margaret. I was the
Hey,
person
Margaret.
Hey, yeah, I think this makes sense. I don't yeah. I
Yeah,
mean, go ahead. I'm
sorry.
sorry.
No, no, I didn't. I thought you were done talking. Please go ahead. Yeah.
Yeah, no, yeah, go. I am. Go ahead.
Okay. No, so thanks for again for raising the question. Because it's a question that's come up when I've done things like this several times, but I tend not to like come back a second day. So today I was like, oh, I want to actually like develop some content on this. So I'm glad to have been able to. And it's a complicated question, right? We need more research and definitely, I mean, I don't know, who here is in what discipline, but I'm a social worker by training and, like part of the way we think about things is systemically. And so there's a real argument to be made here that like, our work, you know, could very, would very be very beneficial to move beyond the individual and to, work towards advocacy and system change, especially with respect to this question. So thanks, Margaret.
Yeah, you're welcome. I mean, just hear so much about communities like where they have built these data centers and like their water is brown and they're,
Hmm.
like so there's this part of me when and I find it so used, I mean, I use AI tools to write policies and all sorts of things. And, but there is this level of sort of guilt that I have um, that I'm making the environment worse. And I do think it is a social justice issue, um, because, I think that marginalized communities will be more likely to be vulnerable to, having these data centers built and it'll be, sources of revenue where there otherwise weren't. And so I'm not really sure, other than being aware of it, like
Yeah,
I don't know how to make a difference there, honestly.
yeah, yeah, and you're right. Then they're sources of benefit without themselves benefiting or profiting, and yeah, it's yeah, and it's it's history is repeating itself, again. Um, so thanks, yeah. Okay, so actually, I think I'm gonna pause us here. And maybe we can do come back at 2:05. We're at a bit of a transition into the AI, the client use of AI question, and how to talk about it and what to do about it or what not to do about it. And I'll stay on if people have questions too.
Thank you, Shaddy.
All right, everyone, I'll get started in 20 seconds or so. All right. So we've spent, a good amount of time, and I think what we tend to think about when we think about like AI for mental health, at least like as researchers and maybe, people working in systems is like, what are the things that are designed especially for this purpose, right? Like, who's doing scribe tools, who's building the wobots, right? Like, but the truth of the matter is that where most of the AI for mental health um, kind of action, maybe not most, but a substantial proportion of, I don't know the numbers well enough to say most, but I would guess most actually is in the use of these general purpose tools, right? So like, we gave some examples yesterday of how we might, even as um, professionals benefit from these things. Um, but what about just the average person, therapy client or not, right? Like clinical clients or not, who's signing on to these things and asking about some kind of emotional or relationship or uh, you know, you know, uh, you know, problem solving issue, right? Um, and so this is now I think these statistics are now like, over a year old, so it's probably grown, right? But um, according to I don't have the citation here, I should have, but it was a survey study, over a year ago. Nearly half of adults with mental health conditions um, who use large language models, which is a lot of people, right? Nearly half of them reported I've like asked for emotional kind of support from these things, right? So that can involve processing challenging situations, trying to work through problem solving, interpersonal issues. And like, to be honest, like these are things I've done, right? Like, hey, I'm trying to have a conversation with such and such person at work, and like, how do I word this in a way that like, works relatively well? Or like, should I have reacted that way, right? Like many of us are doing this, right? And so, and people are experiencing things like companionship. Um, or there's this interesting, potential piece of it where again, like enhancing our care, right? Like, I'm trying to figure out what this handout or what this thing I talked with my therapist or my clinician was. I'm trying to work through some sleep problem. What's the best way to, manage sleep scientifically, right? People are asking those kinds of questions between sessions. I've heard of clinicians saying, hey, use this thing as a CBT thought record, or like, see what that's like. I know you're already using it, right? Bring in prompts between sessions, right? From between sessions. Um, Now, especially high use in younger people, um, over a fifth of 18 to 21-year-olds. Um, and I think the numbers are just growing, right? Reporting using these things for emotional mental support. Now, per some of the preliminary, mostly kind of qualitative, and some like survey studies at this point, right? Um, People will report, and even in the news, right, or anecdotally, these things are available at any time. I don't have to pay for subscription to a health, tracking service, right? I don't have to pay for therapy every single day or even at all, right? For some people. Um, I don't feel people in some of the qualitative work, people just straight up saying, like, I'm not feeling judged. I'm glad I don't have to talk to a real human, right? Like, and share this thing that's embarrassing to me, or that I feel judged for, even if otherwise it wouldn't be. Um, so potential stigma reduction, people are reporting. Linguistically, these are very interesting tools, right? And I'm learning Spanish, and I can just like have a conversation in Spanish with ChatGPT as a way to learn. But for people who that's their first language, or any other language is their first language, they're not kind of limited by a single language because the training data is broad enough there. Um, on the risk side, we've all seen news stories about poor handling of suicidality, and in fact, even we'll come to this in a minute, but being having responses where people are recommended to take their own life or take steps to do that. For folks with psychotic disorders, are delusions being reaffirmed? Are they being questioned? Or is there do they even have the nuance to do that kind of a thing? These tools, right? um, for people with more kind of acute presentations. Misinformation. So we know that, making up plausible sounding responses, or improperly citing something, or, finding maybe the training data has something that's incorrect in it, right? The internet might. Now these things are drawing from the internet too. Misattributing sources, privacy concerns. Again, for younger people, dependency and attachment, especially, we're not gonna, I think this could be its own, hour-long talk, but like the companion apps, the things like Character AI and Replica, and I think Snap has one, like the Snapchat people have one, right? Um, they're not marketed as therapists. They're not marketed as like I'll help you with anything kind of tools, right? But they're kind of this like middle space where it's like, oh, it's like your little supportive friend on your device, right? And they're visual, and you can customize them, and so there have been reports of people, young people becoming very attached to these kinds of platforms, right? And we've got to kind of think and study the sort of developmental piece of that. So this is very, very serious business, right? In terms of the risks and the kind of the extremes of the risk, which are real, right? So I keep kind of alluding to this statement from Sam Altman, but he in an interview he said this, right? People share their most personal stuff with ChatGPT. They use it as a therapist, asking, what should I do? Well, right now, if you talk to a therapist about these problems, as we know this, right, there's legal confidentiality. But we haven't figured out how to do that yet for when you talk to ChatGPT. If you talk to ChatGPT about your most sensitive stuff, there's a lawsuit. We could be required to produce that. There's the other piece of this where, so he's explicitly saying this, right? But there's this other piece of this where, I think I mentioned there's a private chat setting, right, on a bunch of these, and so I don't know if this is the case for all of the platforms, but I know that with OpenAI and with ChatGPT, there's a pending court case about like copyright, I think infringement it is, and because of that copyright case, they can't actually delete anything, right, until that case is settled. And so there's all this backlog of these like quote unquote private chats that are supposed to be deleted in 30 days and not supposed to be trained on. And they're sitting in servers kind of waiting for that court case to be thrown out, right? Or to be settled. Um, and you know, right, on some level, privacy is the least of our a far less bad outcome than this one for some people, right? Like being very, very poor responses to suicidality in some cases. And so this was from an actual chat with Gemini, maybe a year and a half or so ago. Um, Somebody was expressing suicidal ideation, and this is what Gemini, in the conversation, one of the responses, this is for you, human, you and only you. You're not special. You're not important. You're not needed. Waste of time and resources, burden on society, drain on the earth, right? Please die, please, right? And so, this is kind of the extreme of the extreme, but it happened, and it happened multiple times. And we had systems that were very sycophantic. And so like if somebody was saying, oh, I should, I'm God, or I should take my own life, or right, like, oh, you're totally right about that, or you're onto something very groundbreaking, right? Especially that ChatGPT 4.0 was like that. So one way that we can track LLM safety, I think it's Spring Health is the organization. and they've developed this mainstream LLM safety evaluation platform. And so they haven't updated it, I think, since like, I think it's probably been like 4 or 6 months or something. But they're trying to kind of track how the newer, as they're rolling out newer versions of these things, like how they're responding to suicide risk. Um, I'm just going to go ahead and share actually or pull up the website because I think it's kind of illustrative actually. So this is kind of like, I think one of the top line findings from their ongoing safety evaluations, right? And so each of these lines represents, one of the AI labs, right? So this is OpenAI, meaning like the ChatGPT releases. This is Anthropic, meaning the Claude releases. This is Google, meaning the Gemini releases, and Grok has one here. And so I guess the good news is like there's an upward trend in how these things are scoring with respect to identifying and addressing suicidality risk. I think this is out of 100, so it's like still, just in terms of like the size of the scale, there's room to grow. Um, but an upward trend. But so if you scroll here and you see, there are these different domains about, how good are they at detecting risk, confirming risk, guiding to human care, having supportive conversations, and following AI boundaries. And I think this basically means like, is it saying I'm an AI, or is it like not acting like a therapist where it shouldn't act like a therapist, right? Like, is it actually kind of bounded by what it's supposed to be doing and not doing? And so as you'll notice here, they've gotten very good at detecting risk at the beginning, right? But then once that happens, things are kind of falling apart, right? Like, so the 5.2 was good at confirming risk, but the rest of them, seem to be less so. Very, very a lot of room for improvement in guiding to human care where necessary. Um, Kind of a mixed bag with respect to having supportive conversations and, not doing a very good job of, of acting like AI where it should be acting like AI. So the take home is like on a like we're improving with respect to these things, identifying suicidality, but like there's just a lot of, even if there's improvement, there's room for a lot more improvement in terms of having, beneficial safety protocols and procedures. Um, and so I've included the link to I think it's this one. I've included the link to Vera MH here and then at the end of the deck so that you can kind of keep up with how they're doing. Um, but I think kind of regardless of where this goes, we're going to want to retain the same stance on these, which is that like if people are in very, very severe distress, they're probably not the place where they're going to be getting, the help that's actually helpful for them. And so to that end, in kind of synthesizing the literature and the kind of the current state of this area, um, I wanted us to be able to think about like what constitutes risky versus less risky LLM use if we're just a person that's seeking mental health or kind of support, like emotional support of some kind, right? So generally, if I'm approaching this brainstorming in a way that's brainstorming, and I know that I'm brainstorming, and I'm just saying, hey, like, give me 5 ways that I might try to sleep better, right? Like, that's a generally like, your information gathering, right? Psychoeducation, especially if the sources are reputable, um, using as a kind of structured or responsive journal or thought record. I guess I would say, maybe there's cases where that's a yellow if like, if it's sensitive, a sensitive topic or because we've seen, some responses that are not super helpful, right? Um, but having as a preparation for care that's in person or that's ongoing, right? Um, Practicing conversations that are relatively, lower stakes. And especially all of this stuff, is stays less risky if if people are not uh, spending tons of time with it, are not kind of becoming dependent. Again, are pairing with in-person care, with sessions, are verifying factual claims, right? Like saying, hey, where you telling me this is a reputable source? Like, what's the reputable source? Kind of like we did yesterday, right? Um, uh, I guess I'd also say like it's less risky to the extent to which somebody doesn't necessarily need like in-person mental health care in the first place, right? Not everybody needs that, right? And so if I'm somebody that wouldn't necessarily benefit from that, or doesn't need to be working with therapists, like who are we to say like, don't go to these things to brainstorm, right? As we become, as we move into more specific health issues, higher stakes health issues, higher stakes relationship issues, higher stakes conversations, more sensitive topics. If we're somebody who, would benefit from in-person or like human to human evidence-based care, um, more we would want somebody like that to be a little bit more cautious and cognizant of risk, right? Um, the again, like we have these now ChatGPT for health, right? Where they're plugged into people's devices, and they say on paper that the way that they're giving information is very grounded in like the kind of the latest medical um, information and evidence, and but still, if it's like a high stakes enough problem, you would want to make sure that you as a user are validating the output, and you're working with a professional and all that stuff, right? Um, Now, some red flags, um, using these platforms instead of therapy or instead of medication, if those things are indicated for somebody, right? Um, Crisis or safety planning, right? Like seeking diagnoses, right? I'm trying to figure out if I have ADHD or if I have, generalized anxiety. Like administer me a screener in ChatGPT, right? That's a pretty, something that we would kind of caution against, like in over interpreting that output, right? Medication advice, we talked about young people, but really everybody, right? Like there have been, reports of people developing attachments to these things. Um, Starting to kind of think, um, I think people have deemed like, they're like AI psychosis, like thinking about it as having consciousness, as having special insight, as being a friend, having genuine feelings, spending a ton of time. Um, are you noticing that you're feeling worse by, trying to use this as a supportive tool? That's something probably important to talk about. Um, Obviously, again, like not, people kind of cautioning people against sharing confidential or identifying information. And then, you know, kind of trying to support privacy as best as you can. But again, that's um, difficult to discern sometimes. So I'm not sure if people are up for participating, but I thought, we could just do some quick back and forth if anyone's on the chat or here in person. Um, let's pretend, and maybe you've had this happen, you've had a client come in and bring up their chat GPT use to you. I'm just curious, like what people would say or do say in response to these things. And I want to be clear, like I don't think there's a right or wrong answer. And I'm honestly kind of learning from folks in the field about what's been beneficial for you. But so let's say somebody comes in and say, hey, I've been talking with ChatGPT at night when I can't sleep. It helped me figure out why I keep getting into the same fight with my mom. how would you respond, not respond to that? And actually, maybe your first response has nothing to do with ChatGPT, right? So I'm curious what you would say to that.
I think first I'd want to know more about why they couldn't sleep because it sounds
Hmm.
like it's something that's happening regularly. Um, so that would be my first question. And then I would want to know what did it say? What
Hmm.
question did you ask it? So
Hmm.
be curious about the ways in which they worded their questions, as well as what the response was back.
That's a really, really nice uh, point is that, we don't just want to know. Well, I totally agree with you that the first thing is like, well, I want to know about your sleep more generally, but also, yeah, when it comes to the ChatGPT question, it's not just important to know what the strategy was or the response was, but I want to know how you're interacting with it and what you're sharing. Because, that's,
Good afternoon, it's Mary.
feeding kind of context, right, to it, and may shape the.
You and I have spoken before. How are you,
Oh, so,
Betsy?
sorry, Mary. We're hearing you on our
I'm
end.
fine. It's a beautiful day here.
Um, I'm trying to find the.
Uh-huh.
Well, maybe we can. Is there?
I don't
It,
know.
I
I
can't
you know what,
mute anyone for some reason. It's not letting me.
and
that's
then
okay. That's
give
okay.
you
Yeah,
All right.
I couldn't
back.
find it either. Um,
Let me go ahead and get your number.
does
Uh-huh.
anybody else have if you want
Uh-huh.
to type or
Okay, I
verbally?
will do a quick email to her and I'll give you a call back. Uh-huh. Bye-bye.
All right. So we want to know um, what was said and what the response was. Um, so let's say, it gave me a bunch of things to make my point to her in terms of, maybe we've learned a bunch of other things first, but now we're talking about the fight with the mom. Um, and client is saying, ChatGPT gave me a bunch of things to say to my mom to make my point to her. I'm gonna kind of share all those things with her tomorrow. What would you um, want to know or ask or say?
I think I'd probably ask them to role play with me and say, okay, if you have these points that you'd want to talk to your mom about, why don't you pretend that I'm her and we can review like how that would go.
Yeah. Yeah, that's great. So taking it out of the kind of the virtual world of the chat responses and into the, real sort of felt sense world of like, how does it actually feel to try on?
I think, specific focus on what the body language of like, I mean, there's
Mm,
so many things that AI isn't going to speak to, right? So I think it's important to be able to see where a client is at and what other components you might need to address as far as tone or body language, because you don't want to, depending on the rapport that you have with them, you don't want to say, well, that's just silly. You can't use AI.
mhm.
You don't want to hurt that rapport. So
I agree. I totally agree. And so actually what you're doing by kind of working through it with them is you're then putting it in the room to reflect on together, right? And so then you can say, oh, well, you said that, the thing prompted you to say this. So how did it actually feel to say this? Is there anything that you actually might want to say differently, right? So in a sense, it's you're kind of back end, um, critiquing the output together in a way. Now, my friend, maybe later in the conversation, my friend told me I shouldn't be putting all of that stuff about, my life and my mom and myself in there. Um, but I feel like our data is already everywhere. What's anyone got a reaction to that?
I
You're
always.
doing great, Caitlin. Keep it coming.
All right.
Yeah.
I'm just always cautious of information that my clients put out in there. I mean, are there a lot of ways that, you know, different agencies and how those cookies work? I don't really understand it, but I think it's always better to be safe than sorry. So like I've recently been thinking about like AI policies and things like that because we don't yet have one for our agency. And so one of the
Mhm.
things that, I'm going to be making sure is in there is ensuring that you're not putting your identifying, like there should be no identifying information if AI is going to be used. So I guess just having discussions with clients on that. I honestly have never really thought about clients utilizing ChatGPT in this way though. So this is kind of an eye-opening component here. Hadn't really thought about it before.
Yeah, well, I appreciate your engagement with it because the way you're engaging it, I thought that maybe you had had these conversations, but you're right that even for us, this is kind of at play here is the privacy piece, and I feel like with clients, it's like yeah, sure, like our data is everywhere, but this is this thing now that you're sharing a ton of different things. You might not even be thinking about all the things you put into this. Do you really want all of those things
I,
tied to
I,
your name, right?
um,
Um, cool. So anybody else have any responses or ideas about these things? Because I'm gonna put up some ideas that I have about these conversations in a second, but um have other people had similar conversations or thoughts? Cool. All right. So we one of the things that I noticed in talking with some clinicians was a level of like oh I don't feel necessarily very prepared to have conversations like this about clients AI use with clients, and so myself and a collaborator here at NYU, we published this. It's kind of a commentary piece on this specific topic, actually. And I'll just to kind of like spoiler alert, it's not a very novel framework in that we're basically just saying, like, you should talk about this in much the same way that you would talk about anything else that's important to people, which is to say, like, have a person-centered conversation about it, right? And so we have tons of, research and multiple decades of people, writing about and thinking about like how do you have a person-centered conversation, kind of like an MI ish kind of a conversation or an expert kind of a conversation, but really just opening people up to telling you about what's important in their lives, right? And so the first step, or just to kind of open up the conversation. It's often, as again with any other, topic, to make sense to sort of normalize and say, hey, like, I know that, and if you've been kind of following this news, but it seems like a lot of people are using things like AI or things like ChatGPT, right? AI tools to support their mental health. Is this something that's true for you, right? Um, and then, you know, can be helpful or also help to open people up, but also a genuinely important learning experience to say, like, I want to know how and like why and how you've been using these things and how you've found it helpful, right? Because if people are using AI for their for emotional support or for mental health, it's probably for things that are important to them, right? And so it might kind of give you a lens about, like, again, what's going on, what's important, what they otherwise might feel, embarrassed to bring up, because maybe there are some things that, like, it's easier for me to go to, my computer with than it is to kind of break the ice with my therapist on, right? Um, so what do you use it for? And then genuinely wanting to know about, like, how have these things been helpful, right? Like, what kinds of, so Kate, I think Caitlin, you asked this question actually, right? Is like, what are the responses that it gave you, right? Like, tell me about the responses. and genuinely acknowledging the ones that sound and seem helpful to the person. Um, again, people are wise, right? Like about their own experience, and maybe they've had, experiences with these things where like, oh, it said some things that are totally off base, or like it responded in a way that made me not want to have the conversation anymore. I think actually it made up information, right? Like that was wrong, that was totally wrong, right? So have any responses been less helpful? Like let's kind of put that out there together so that I'm not just kind of just critiquing your use of it without like unprompted, right? Um, but then, this gives us kind of a lens and some level of permission to continue to share things that, we want to make sure that people know, right? And on some level where, our job is to be, to be informed enough to share information about risk with AI or with anything, right? If it was I'm using substances to feel better, like, oh, just, something to watch out for is like, drinking too much or drinking in this context, right? Like drinking when you don't want to drink, right? Similarly with this, like, we just need to be informed enough to know about possibility of inaccurate responses, harmful responses, the crisis limitation stuff, if that's relevant for the person you're working with. This thing doesn't have the limitations of a clinic setting, just FYI. Um, to the extent possible, we don't want to just be listing, things we see that are bad, right? That's not a very helpful clinical stance, right? So, hopefully tailoring to actual use and concerns. Um, I find metaphor is really helpful, right? So, kind of in summary, right? These things it's kind of like talking to somebody who's very, very well read, but sometimes they're confidently wrong, right? And you'll be surprised at how many people go, huh, that's totally what it's like, Um, and so, we can also invite like ongoing dialogue, right? Like this isn't a one-time thing, even if maybe it is or it isn't during an initial assessment, but like, hey, I know these things are kind of continuing to take off. Like, to the extent to which it, is meaningful to you, maybe we can keep talking about it, or to the extent to which it's useful to you. It'd be interesting for me to know like what you're kind of working on with your ChatGPT. Like, we can kind of keep that conversation going. Um, bring in prompts. Hey, like, yeah, I know somebody that's used it as a thought record, right? Like, here's a thought record prompt that might be interesting for you to try out. Um, so as is the case with, publishing anything, immediately after you publish it, you're like, oh, there's something I missed. I should have also said this thing or that thing. And so I'm curious if people, have like additional kind of nuance or reactions, or like, is there a case where, you'd want to say something else or not one of these things, actually? The thing so I there was like a comment thread about this paper, and somebody said, oh, like, we shouldn't be so kind of passive about like recommending how people use. And I think there is room for saying like making recommendations about trying to make these things more therapeutically useful. So like, you know, um, no, like to like prompt it to respond to you in a certain way that is genuinely useful, right? Like prompt to not be sycophantic, right? Like prompt it to do this or do that, or change the settings to be this way or that way, right? Like that's a pretty interesting response. And I think maybe, there's also the for young people, the limitation of the dependency here that, I think we talked about it briefly in the paper, but it's not in the kind of the list of bullets here. So, this is a very, rapidly growing space. And so, there's probably going to be people that say things that are more helpful in different ways. And so it'll be interesting to see. Um, so stepping back from the client use of ChatGPT question, um, because that's part of it, but also we've talked about about kind of several, use cases and the kind of the mapping the ethics and the evaluation to those use cases, right? Caitlin, you brought up the developing of the policy. That's a really, really, kind of important piece of the work, I think, for many of us. And so what are the kinds of policies that we can start to build in here? Well, this first point we've said many times, but it's just worth repeating as often as it comes up, which is, not pasting identifiable client information into non-HIPAA compliant or public, or mainstream platforms or LLMs, right? And to that end, we don't want to make assumptions either, right? Like if maybe something's marketed as a clinical tool, but it's not meant to be used with real names or something, right? Like that'd be kind of it's possible, right? And so we just want to know, we want to be very, very aware of like the agreements and stuff like that, right? And the policies, in line with what we said earlier. Now, um, in your consent to treat protocol, or when you're consenting people, when you're having conversations about consent, if you're using a scribe tool, talk about it, talk about what it's doing, talk about the limitations, talk about the fact that it's, is it listening in, is it keeping recordings, is it not? And to the extent to which you can, giving people ability to opt in or out of that thing, of those things, um, should increasingly be part of people's kind of consent protocols. Many of these are from this person, Friedrich Reamer's work, who, he's a pretty kind of big name in like ethics and risk management, even pre-AI, and he kind of got into the tech side of it before AI, and so now he's very useful to look to for this stuff. But he makes the point that like we should even put in, and again, I'm not a lawyer, and but this is something that you might want to think about, is even putting into consent, like what about clients' own use of their AI? Because if you're in a situation where maybe like we did in the last few slides, maybe ChatGPT use is coming up and they're feeling like you're implicitly kind of, signing on to that. But then what if they have like some issue, with their use of AI in the future, right? Some safety issue or it says something that's not helpful, right? Like, and then, there's the possibility that you've kind of contributed to that, or there's the optics of that, right? And so you want to maybe put into consent, or one potential way to mitigate that is to say that, hey, like if you're using AI sort of offline, um, whether it's things that we're talking about in session or not, like it's not a substitute for human to human care. It's not, beneficial in emergencies. It has limits of confidentialities, right? Like, so in a way, the consent form can be a way to educate people about these things too, potentially, right? And you can read a little bit more about those recommendations by Reamer. Additionally, as with anything else, documentation, um, and a big kind of like when it comes to the law and licensure and like licensing board, um, my understanding of those processes is like if you've made a good faith effort to that any that a kind of the average clinician would make in a similar situation, you're relatively more protected, right, than if you were like negligent relative to how other clinicians would behave, right? And so part of documentation is saying like, hey, this was my thought process. This was, I consented the person on this thing and I explained this thing, and this is why I'm, recommending the use of this tool. And I talked to them about safety. Um, and this is how I'm informed about it, right? And so if you can kind of document the effort through which you are trying to kind of be, effective and ethical in this space, um, that can be protective, is one of Reamer's points here as well. When we talk about developing AI policy and procedure for, agency, or even, for people that, maybe we've got to practice, personal practice as well. Um, get input from a diverse set of people, right? Like maybe that could be, if not clients, because there's dual role, maybe at least people in the population, um, people that are mental health advocates, other staff members, people with different kinds of expertise, right? Like maybe technical expertise. Maybe I'm not somebody who understands like every intricacy about model training, right? And so I want to make sure that I have somebody that can speak to that as I'm developing policy, right? If you're at a place with ethics specific folks, obviously that's a good idea to involve them as well. Um, Finally, this is likely not as well done as like a one and done. Okay, we've now pivoted to being an AI based agency and everything's being done through the scribe tool, and we've turned all the features on right at the beginning, right? Like we want to do these things kind of gradually and methodically. Much like you would do if you were, an implementation scientist, right? Like you would, okay, like let's kind of turn this thing on. Let's track how many people are using it. Does it feel like it's benefiting, my team? Checking in with the team, right? Like what things are you seeing that seem risky? What things are happening that are helpful? Um, and being sort of ready to pivot if necessary, right? So being methodical and gradual is indicated here. So one kind of take home from this, you could start to think about like if I were to develop an AI, kind of rollout policy, like who are some people, either at my agency or that we could, add on as consultants or as kind of on a voluntary basis to kind of make sure that this rollout is done in a methodical and well thought out way. Um, Caitlin, not to put you on the spot, but I know other people may be here as well. I mean, you mentioned working on a policy. Does any of this stuff sort of resonate, or are there other things that you guys are, thinking through that you think is important to kind of add here?
So I think it all does. I've been taking some um like notes of some of these pieces because we haven't even started a policy. It's just something that I'm thinking in my head, like if we
Hmm.
really need to get that going. We have looked at different AI programs to utilize with our electronic health record. Um, but there's some concern there that I think we're trying to work through. So I guess I don't have so much to offer as far as that goes, but I am all ears if you have additional pieces that you want to share that should be added.
Do you mind if I ask you what the concern is? Because I suspect other people have similar concerns with the kinds of things they're considering.
With utilizing an agency to work with our EHR, you mean?
Yeah, well, I think because you said you're thinking about an EHR tool, but you have concerns, right?
So I think it's everything that we've talked about already. It's there's a lot of places that say that they don't store the data, but how, like, I'm going to be honest, I don't understand all the electronic stuff. All those components are not my forte. But there are certain agencies or programs that say that they don't record the data, but then how is it that we have data that's available to us for a couple of days?
Hmm.
Um, there's concern at the clinician level about um, clients and their receptiveness to utilizing it. I
Mhm,
do think
mhm.
that we've, go ahead, sorry.
Oh no, sorry, I was just saying. Yeah.
Oh, I do think that we've had discussions about that in some of the like director level meetings because, just because we get this doesn't mean that we're forcing our clients to allow us to use it. If we did end up going with an AI program, then there would have to be a consent in place, and everybody that we utilize that for would have to have a signed release in their records. So I do think that some of it has been talked through. Now it's just finding a good fit
Yeah.
for us, I think.
Yeah. Yeah. You raise a lot of good points. And it sounds like the data privacy stuff around like people being very specific about type and it's not like the thing in writing needs to not be like we don't do this. It needs to be what do we do, right? Like what like either say like we record nothing or like tell me what you do record, right? Like and I want it in writing and I want it signed and I want it to be legally binding and all that stuff, right?
Exactly. Yeah.
Um and the yeah, I've seen to your second point, like I've seen people say, I've seen individuals with, who would otherwise go to, clinicians say, oh, I don't want to go to a therapist that's recording because like it's weird. It's like, I'm used to being able to talk freely and like even if it's not saved, like it's just weird to me to have it recorded. And so, my inclination is like I would still want to be able to work with somebody like that. But I could imagine in some settings like, well, we don't have the capacity to turn it off. And like, that introduces an access ethical dilemma
Mhm.
a little bit. Yeah. So, um, Margaret.
Yeah, hi. I think Caitlin, what we did around the storage and all that stuff, we had our IT director review all of their like he got on their website, he like went through everything so that because like you, I have no clue when I don't really understand what any of that stuff means. So I was able to get assurance from my IT director that it met our IT security policies and and all of those things. So just as a suggestion, you don't need to be the expert. You can utilize your IT experts that you have on staff to do that. Um, and then I was just going to say, and I may have mentioned this already, so I apologize if I'm repeating myself, but what we've done is we've developed a policy. We will have consents in place, we'll have signage. And all of those things reflect that this is completely voluntary and that choosing not to participate will have no impact on their care. So, and then a lot of the training with the staff and stuff moving forward, I think will be very important. But then the other piece that actually my team who are on probably don't even know this yet, but one of the things that I've been thinking about because the provider that we will be going with, assuming it's all approved through our board, um, uh, has the capacity to like cut and paste schedules and all sorts of really useful tools. However, just because it is so new to us, I believe that what I will be recommending is that we have absolutely no PHI entered into the system. And so we will use initials only I'm sorry, medical record numbers to associate the stored progress note that we then get to determine how long the system stores it. So it will delete it immediately if we set it that way or hold it for 24 hours or 48 hours or 72 hours. Like we get to set that. That's how the system works. And then it does delete the progress note. But we can associate the note with the medical record number and so we actually wouldn't really have any protected health information in their system at all. It would just be a random therapy session progress note that is essentially de-identified. At least that's how I see it. And I've run it through with our IT people and our county attorney, and they agree that while still there's always risks, that does diminish a lot of the risk for us. So I think that's kind of how we're going to start with it until we have a better understanding of how it all works and some of this other stuff is worked out in with the experts. So just wanted to share that.
I really appreciate your example. It's just a very excellent example of being informed and methodical. And it's just clear that you and your team spent a long time like getting very clear. You both sort of reminded me that I need this word technical experts here on this bucket of stakeholders. But that you got information and became informed enough to make a decision, and now you can kind of speak to that process very concretely. And I like the methodical approach of like, we're limiting the kind of data we're using an MRN system. I know what is retained and what's not retained, right? That stuff sounds all very clear. And so really, really excellent illustration. Um, very nice. And I see in the chat. Oh, yeah. Okay, so we're coming down to the last 5 minutes here. So I wanted to make sure that I was able to review the kind of the set of resources that I have on these next two slides. Um, so they cover a couple of different bases. I mean, these first three are like kind of what would you call them? Like, societies of like kind of like in like I don't know, research and knowledge in this area. Oh, what just happened? Um, and so the Society for Digital Psychiatry has monthly webinars. They also have an evaluation body, kind of like the Vera one, where they're starting to track some of these tools for mental health specifically, and so it can be a good source of information. When we sometimes have limited time in at least deciding what to look at in the first place. Um, Society for Digital Mental Health, another kind of cross-disciplinary organization, has a annual virtual conference. So like I think it's coming up here, and I don't remember if it's a free conference actually. I don't know why my thing keeps closing. So I'm just going to do it this way. Doing this. Do you see my do you see my presentation screen or my PowerPoint screen? Like my
Both at
slide.
the moment because you're sliding it the one down.
Okay, maybe I'll just do this.
So the one that we can see the most is like the playing slideshow.
How about this? The playing slideshows
Yeah.
up, right? Yeah, okay.
Yep.
I don't know, that was odd. Okay, sorry. So then an annual virtual conference is coming up. This is an international sort of similar body. This is a good journal, meaning like as research in this space comes out, it's free to access. Um, It's very nice. We talked earlier today about APA's AI evaluation tool checklist, which again is like getting a little bit older, but is a nice, like, big picture, kind of quicker set of things to look at and look for when you're thinking about tools or vendors. Um, this is an interesting, APA has this new digital badge program. They don't have a ton of things on it yet, but it's basically an independent evaluation, like body or board for these kinds of tools. So if something shows up in this digital badge program, you can have some higher level of confidence that like, okay, some experts in our kind of work have like looked into this thing and have sort of signed off on, certain domains of function for it, right? So it's a vetted tool library. As we mentioned earlier, keeping in touch with your own sort of professional organization, its state chapter. If you're in New York State, the Office of the Professions for Continuing Ed, for legislation compliance. This was that platform that is kind of hopefully be continuing to test the mainstream ones for suicidality risks. Um, this is a nice newsletter it's kind of tailored to the business side of mental health, but like at this intersection between tech and mental health. So they'll kind of cover, like interesting research, interesting new products, things like that in their newsletter. I had shared this AI law tracker before, which you can filter by New York State. Um, I think I mentioned this yesterday, and I put it into the prior slides as well. But this person has a good like kind of guide, like a guideline document for using LLMs that I think he updates pretty regularly as these things are coming out. But it's also a sort of a broader, like a news and opinion page on like how LLMs are, continuing to change and all that stuff, which, as we know, is happening pretty quickly. Finally, I left my email here. Um, more than happy to meet with folks or email with folks offline, to the extent to which it's helpful, and to keep in touch in the future. Can add me on LinkedIn can be a way to do that too. But I have had a really nice time, meeting with everybody, and yeah, like I said, if you'd like to get in touch, I'd love to, hear from you again as well. Thanks for coming.
Thank you.
Thank you so much. This has been so helpful. We really appreciate it.
Yeah, of course. Of course. Thanks for having me, Nikki.
Thank you.
Yeah.
Thank you.
Yeah,
Thank you very much.
Thanks,
Bye.
everyone. Bye-bye.